everyone, welcome to my YouTube channel. I am Nurse Patience. In today's video, we'll be talking about tablet versus injection treatment. Many people have of the impression that the route in which drugs is being admitted tend to affect its effectiveness in handling a particular disease condition. I do not believe that stand. Why? Because both injections and tablets are both effective and they are very good and the most commonest route of drug administration. What I would like you to know, speaking from a medical perspective, is both tablets and injections are both dependent, or the route in which a particular drug is being administered is dependent on the patient's state of health at that particular point in time. You would agree with me that there are certain conditions that would not allow a patient to take drug orally, which is the tablet form of medication. Most individuals will not be able to tolerate it. Why? Because I will give you an example. For individuals who are vomiting or for individuals who are unconscious, it is contraindicated for them to take tablets orally. So the route of administration for them that they are open to now would be injections or parenteral method of drug administration. Route of drug administration is dependent on the kind of condition that needs to be treated. For example, an individual who have hookworm infestation. We all know what hookworm is. It is a worm that is found in the stomach of an individual. Most individuals at a particular point in time in their life tend to have hookworm infestation, and it is very common among Africans. So with hookworm infestation, you cannot tell me that you'll be using injections to treat hookworm, because you need to take that drug orally, because for most injections they go directly to the bloodstream, but for this hookworm infestation you need to take this drug orally. That's the tablet form of anti-helmintic agent to be able to go kill that hookworm inside your digestive tract. So drugs for most times are dependent on the kind of condition you want to treat. Let's say you have an eye problem, it will be best to use an ointment or eye drop for it. You do not need to go through the process of having an injection, because for most of those ocular conditions, it is usually on that particular affected area that you would have to address. So it is same thing I'm bringing to the table with tablet and injection. You cannot Most individuals, they come to the setting and they want to detect for the healthcare provider that I do not want this particular method, I want this particular method. Meanwhile, by clinical judgment, such a patient is fit for most times for tablet drug. Most individuals do not want tablets because of this bitter feeling, or they feel that after they take tablets they are more likely to vomit. But all these things are just perceptions that individuals have recorded, eating that okay, this is what I would get anytime I take this particular drug. I'm telling you today in this video that regardless of whether it's tablets or injections you are taking for a particular medical condition, they are equally effective. Is the speed at which these both drug work. So this is bringing us to the difference between tablets and injections. So please, if you have not subscribed to this YouTube channel, kindly hit the subscribe button and also like and drop comment on this particular video. Injections are one. For tablets, they are taken orally and they go to the stomach, after which they are being dissolved in the stomach. From this they are metabolized in the liver. But for injections, they bypass this stomach route. They go directly into the bloodstream. Back for them to get metabolized, but rather they go directly to the bloodstream to where they get metabolized, which is the liver. Tablets have a slower onset of action. By slower onset of action, say I'm having headache and I'm giving PCM 1 gram to take orally. The time which it will take for that PCM to start working, if another person who is having similar headache is being given IM PCM 600 milligram, for example, that individual would have a faster relief than me that took the tablet drug. So the major catch here is tablets have slower onset of action, while injections have a faster onset of action. The next is tablets are more cheaper and more convenient to take, while injections are more expensive. You would agree with me that what a tablet, a card of PCM highest might be like 100 naira. Why, if you want to get the ample for the injection PCM, you might get it for around 200, doubled the cost of getting a complete card. It can be taken sublingually or rectally, vaginally, and different routes. So when you hear tablets, please do not just restrict yourself to just what goes into the mouth, but tablets can be placed in between the cheek, which is buccal administration of tablets. It can also be placed underneath the tongue, which is sublingually. It can be inserted in the anus, which is rectally. It can be inserted in the vagina. Example is misoprostol tablet, which is what vagina insertion. Then for injection have several routes, just like tablets, in which injections can be administered. The common ones most people know of is intravenous, is intramuscular, but we also have subcute, as in the case of clexine, as in the case of insulin, soluble insulin, in which they are being administered for patients. Then apart from that, we have intrathecal. These are also routes in which you can administer injection. The reason why I gave you this breakdown of how injections or how tablets can be served, or the different routes in which they can be served, is so that when a conversation comes up, even if you are not a medical personnel, you should know that these drugs have other routes in which they can be taken other than just swallowing them. You can either insert in the anus, you can insert in the vagina, you can insert between your cheek, you can insert under your tongue. So these are the various routes in which tablets and injections can be administered. These are the few differences between these two that I have cited in this video. So one thing you need to know about the treatment of a patient with either of these tablets or injection is the patient compliance. In the health sector, drugs are not just given to patients. For most patients, because it is a it's a shared phase in which the doctor or the healthcare provider speak with the client, which is the patient, on which of these routes of drug administration is more convenient for you. So most individuals, they will come out outrightly. Let's say you want to treat malaria, some of them will come out outrightly to tell you that please, I want injection, I do not want tablets. So in that case, if you give such a patient who already told you that I want an injection and not a tablet, if you give such a patient tablet, the patient might not be compliant with those tablets. That is, might not take those tablets, which will make this medical condition malaria not to go, and if the malaria does not go, healthcare provider and the patient's relationship will not be a good one, because what brought the patient to the healthcare system have not been addressed. So treatment is better and more convenient for you. Whenever you see your healthcare provider, you try and discuss with them and get their opinion about it. But effective. Please do well to drop comments and also like this